Trials presented with the Amgen PCSK9 monoclonal antibody inhibitor, evolocumab. There are a number of fairly simple take-home messages despite a massive amount of data. One is these drugs continue to be very effective, lowering LDL cholesterol in all types of phenotypes of patients and all background therapies in the range of 55 to 65%. The second message is that they continue to be very safe, so no surprising news and consistent results throughout. The specific studies, the Descartes study, which was the first and so far only 52-week double-blind randomized trial, shows that efficacy that we've seen at 12 weeks with all the other trials, including some of the phase 3 trials released today, remains the same at 52 weeks. So we don't see any drop-off in patient compliance, in patient tolerability, increased safety signals, and we see consistent LDL reduction maintained up to a year in these trials. The second major point, which came from Mendel 2 and from Rutherford 2, Mendel 2 being the evolocumab added at 140 milligrams every 2 weeks or 420 milligrams every 4 weeks on a background of just diet. So these are non-drug or statin-treated patients. And then Rutherford being FH patients treated with maximum statin, and 2/3 of them in addition were on ezetimibe. And again, the 140 milligram every 2 weeks versus 420 milligrams every 4 weeks. And what we see is that there are identical results if you measure at the end of 4 weeks post-therapy. So at week 12 for both trials, there were identical results in terms of LDL reduction. And what we've seen disappear with the threefold increase in dose is a slight sawtooth effect that was seen at lower doses given every 4 weeks compared to every 2 weeks. So I think that clearly establishes that there is no disadvantage to giving the drug every 4 weeks in terms of the same LDL reduction. In terms of the Gauss 2 results, which were essentially very similar to that of Gauss 1, other than the fact that the patients had to have failed 2 statins. So instead of failing 1 statin in Gauss 1 and 70% failing 2 statins and a third of the patients failing 3 statins, in Gauss 2 there were even more severe patients with 100% having failed 2 statins, 70% having failed 3 statins, and about a quarter having even been tried on a 4th statin. The entry LDL were almost identical, showing how severe and unmet need this is, with LDL cholesterols between 190 and 200, and the efficacy was exactly the same in terms of LDL reduction at about 60% with the 420 milligram every 4-week dosing, and tolerability up for 12 weeks, showing no increase in muscle-related side effects compared to ezetimibe, and the fact that the drug continues to be well tolerated.